Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello, everyone, and welcome to Sensei Podcast. It is a great pleasure to introduce our guest today, who is Dr. Amr Elhadidy, the president of the Egyptian Working Group on Intervention of the Egyptian CTO Club. He also chairman of the Cairo CTO, great friend, great CTO operator. Again, Amr, thank you so much for joining us today for the podcast.
Thank you, Manas, for this opportunity to have you and to discuss about the journey for CTO.
Wonderful. Well, I know you've had a long journey. You've done phenomenal work on many fronts, both on the clinical side and the education side. But maybe you want to share with us a little bit about how your journey started. How did you become a cardiologist, interventionalist? What made you go through this route?
Okay, as you mentioned, this is a very long road, and you also need to have all the passion and the excitement about this field. You know that cardiology in general, you need to have a way to go through. It's a lot of branches, a lot of things. So the field of intervention make me to look for and then insist to go through. And this needs a lot of work, a lot of teaching points and stations, and to reach the complex PCI before you go to CTO. So definitely you need to have a more experience on complex CTO, complex intervention, and not before CTO, definitely. And then when you reach a good work for complex PCI, so you need to look for a more a green light to go through CTO. And the journey is very hard at that time because a lot of equipment, a lot of wires, microcasters, devices. You need to learn, but when to start, how to start, and this is the point make me frustrated. So when I have to see the cases through the conferences, and then we'll see what to do next. We need to touch everything. We need to go through, and it's not only to see, because it definitely differs when you have a good hands, a good experience operators beside you. And this was the dream, to have CTO operators beside you, and also well-known operators. And this is the start how to go through this field.
Wonderful. So I know you had so many great people who went there and helped you establish the program. But what was the most difficult thing for you building the program in Cairo? I know there's many people with CTOs, but it can be challenging, as you said, with equipment, expertise. What was the most difficult thing for you to build up this program?
Definitely the most important point is, as you mentioned, the cost. And definitely you need to have the full equipment before you start. You cannot start with something which is missing, because if something happens, you will be accused that you are not ready for this CTO procedure. So the most important point beside the equipment and difficulty to collect the equipment is to collect cases every 3 months. And then I do a proctorship to come to Cairo, and who helped me a lot, Dr. Alexander Avran. He's my great friend, also to help him to work together since maybe more than 10 years, 9 years now. And we try to collect the cases. When you collect cases, you have equipment at this date, so you can manage. You can use more cases with less equipment. So if you definitely you have the opportunity to have all the equipment and also cases. So not all the cases will use the same. So and they start how to use the wires, how to feed the wires, and this was very, very important. And definitely I do this proctorship for every 3 months, and then in between I do some simple cases before the next visit and show him what I did, what I learned from the use of these wires. Definitely, anti-grid approach was the first for me to do short CTO segments, not complicated, good stump. So you need to have a way to feel the wires, the equipment.
Perfect. And I mean, what you said is very important about the gradual way of doing it. You don't want to go straight to this super complex, heavily calcified JCTO5, but tackling the simpler lesion gives you the skills and the confidence to tackle the more complex lesion later on.
Yeah.
How about your team? Are there other people who help you with these procedures? How do you, the techs, the nurses, how did you go by establishing the team and helping everyone work together?
This is very important to have the good team beside you. Definitely, when you have a good team, you have a good success for your procedure. Definitely, we fix the team till this our long journey, and we learn also from them, and we learned them how to use the equipment, how to follow your orders, and how to know the difference of wires. Because if you miss and then you ask your assistant to help me and then give me the wire, which wire, because you know how you can open multiple wires and you cannot tell them, look, I want to see what's going on. So they prepare everything. They know how to put the wire after use in his cover, and everything in its cover. So it's easy to help you to go for the maybe not only the simple cases, more the difficult cases.
Perfect. And then, how do you deal with complications, the hard cases? Do you get depressed? How do you deal when things don't go as you plan and you have failures or complications?
Very important to have a very good plan in your procedure. If you fail in one mode, so you can change to another mode. So if not always to insist on this mode. The point is, as we saw in your books and your very good lectures in your cases, Manos definitely have a good, very good textbooks, and I am very happy to have a plan, because this is very important. 1, 2, 3, for maybe for antegrade and then retrograde. But if complication happens, you must be steady. You must be very stable for the whole team. Because if you are very nervous, if you have, you cannot explain what happened if you still in a panic mode. So the point is to have the equipment first. This is very important. You have your coils, you have covered stands, you have the equipment that help you to guide extension, maybe help you to go to solve these problems. Definitely the different sizes of the coils also can help you to solve the problem. If you don't have, you have another option like fat or part of balloon. You can do a lot of things to help to close the perforations, to cover the major complications. For tamponade, you have to be ready how to solve this problem. All things that can help you to be steady in your work.
Wonderful. And Amber, are there any cases, good cases or bad cases, or either way that have taught you a lot, that you still remember because they were very instructive and helped you learn many things?
Yes, definitely. Each case, you need to have a good step for your experience. If you each successful case definitely help you more to go more, but you need to learn from failed cases. Failed cases help you why I fail in this procedure, not how can I succeed. No, I want to learn why, what is missing, which wire can I is better to use. Definitely the workshops that we did after that journey, and I do a lot of workshops in Egypt, and one of these, the Cairo CTO, was it's a very great idea that to do general conference, a lot of expertise and a lot of discussion also help you to learn from even the live cases, and you know how to deal with the complications when it happens, and how to learn use a microcaster, and everything you need to learn in your journey. So each case has a positive, definitely point that help you in your career.
Wonderful. And Amr, I know you've been extremely successful in teaching many other people, both in social media. You organize several meetings. How did this happen? I know it's a lot of work to organize a meeting and get everyone and consolidate everything. How did this happen? And tell us about your meetings and how you came to the ideas in organizing them.
Great, great question. Definitely, when you have a lot of workshops, small workshops, you need to have more attendees, more education for people who starts and who wants to learn how to use. Because also not all the cardiologists can travel, can go for away because of the cost of travel, and definitely the conferences now may be more expensive. So the idea came when I was Alex in that time. Why we don't know to do one of the national meetings for Egypt. So this was the idea of Cairo CTO, for example. And the idea is to collect from over the country. We have a lot of interventional cardiologists in country, and they also want to learn how to do CTO. Definitely, they do a lot of complex cases, and then we start the journey of CTO. They want to learn how to use. We do all the small workshops, simulators. We can do for the how to learn to use the wires, how to use the microcasters, how to move clockwise, anti-clockwise, every step, and even the how to do the curve for the wire for CTO. These points cannot be in a small workshop, so you need a bigger meetings, so learn, and who feel that he needs the more, so he can go join the small workshops that we can do in relation to the big meetings.
Perfect. So it's a combination, as you said, of having the more intimate environment, hands-on, and then the bigger meetings as well. Now, how do you manage to do all this? It's many things. You are having a busy clinical practice. You do the complex cases. You do a lot of teaching. How do you make all this work in your schedule?
Definitely, there is always no time, but we try to schedule our meetings and schedule our job. But the point is, you cannot work in Egypt, for example. You cannot work in one hospital. It's very difficult. You need to work in a university hospital, but it is not enough. So you can do a lot of CTO or complex PCI in different hospitals that you can work in, and then at the end of the day you can go to your private clinic, and this is a very long day, and definitely it comes on the time of sleep. So it's you need to sleep just at least 6 hours, and it was enough for me to do the jobs and to connect the whole day.
So what time do you start your day and what time do you finish your day every day?
Usually I start at 9 o'clock a.m. and finish my according. Usual close at 1 a.m. in the next day, 1 a.m. on the next day. So I sleep from 1 a.m. to 8 a.m. So it's about 6 to 7 hours. But the point is, during the night, not these days, maybe when I was younger, it was cold and at night. The very STEMI patients you need to go and you need to help. But this is definitely, I think this is the life of all intervention cardiologists, and must know that this is the life.
And then do you do any exercise, any other ways to keep yourself in good shape to handle all the stresses involved in those procedures?
Definitely, exercise is very important. Very important first for your breathing, your stress, to be against the stress, to be relaxed during the work, and definitely the physical fitness. And you can not stand for a case for 3 to 4 hours. To do a CTO case, you need to have a good physical fitness. So I usually try to be 3 times a week for exercise, day after day, and starting from some walk, running, and swimming. Definitely, swimming is a very important point in this scenario.
Wonderful. And then do you have any favorite books or any favorite movies?
The best things is to relax, to hear songs, and there's a slow songs, and this is very good to relax. The movies, I like Arabic movies, especially the comedian one, just to relax. Doesn't need the more adventure. It's enough for your career to have the adventure. But the point is you need to relax, and some songs it help you to. The most important a sport that I like, and then I learned and I did it for a great team is basketball. I started since 10 years old. I was playing basketball and joined the team and joined the first team, and I was playing for Egypt for the basketball team because I am tall, so they like my way to play. And I think this is a very important point to learn how to the teamwork. Teamwork with basketball help you to see everyone, to see how to pass, how to play the goal for basketball, and how to score, and how to look by your eyes in every direction. This is very important in the field of intervention. If you are looking for some point you look for the patient, for the assistants, for the technician and nurse help you, and from your look and the connection they learn how to deal with the cases.
Perfect. Well, that's a great example. Congratulations. There must have been a lot of excitement, playing basketball all those years. And as you said, a lot of parallels to what we do right now.
Yeah.
Now, in terms of the things that you are proud of, what are the things that you are most proud of that you've achieved so far?
The point when you save life of a patient, when you're working in a case, not before CTO, I mean before the STEMI case, it's a life case. So if you have the patient, if you succeed to solve the problem, and the patient now came alive. So this is I think this is all the intervention cardiologists like this moment that you save the life of your patients, definitely after God. But I mean, and this is the feeling that you succeed. Definitely when you now after doing CTO, the pleasure time of the most adventure than when you open a CTO. But the point you face that when you succeed to cross the wire, what's next? So the problem is always there is adventure, there is microcaster, there is how to connect. Are you on the true human or false? This is a lot of things that help you always in adventure. So you have a lot of things that you can feel it up and down, and then according to the success of the procedure.
Wonderful. And I know that you're a big fan of social media. Do you use them to learn? And how useful have you found them? And what are the tools that we use to learn from social media?
Social media is very important in our life, and also for learning, and also for you show your cases, and that you succeed in a special procedure you like to all want to see. And definitely in addition to the social media, you can connect with all the international and national intervention cardiologists all over the world. It's easy to connect, easy to say this is a very good case, or how to do this case, how can we learn from these difficult cases that you show us, and also to know the conferences, the meetings, how everything is going. Definitely, this is on the level of the scientific, but also on the level of social activities and how to connect with your friends, and your old friends, and they know that everyone is reaching a level which is good for everyone. So you look for your friends and the support of your family. Definitely, this is also an important point for social media. And so I think social media is now is a very important corner in our life. So you cannot live without social media.
Wonderful. Well, as you said, the work that we do often takes away from family time and makes it harder for the families. Do you show like videos or cases or pictures of your things at work, at home, or do you never talk about it? How does it work when you get home after a long day in the cath lab?
Yes, this is the time to relax and stay with the family to discuss away from the your job. But there is a problem always here. In I don't know, it's always in most of the countries, especially in Egypt. You need the patients are always connecting with you through WhatsApp. So always what I do, what I do. So if you look for one message and then you left him for 3 to 4 messages, and then I wait, is very angry, the patient, that you are not responding, you are not answering. So this is always sometimes break the relaxation time. So but this is life, what to do.
Absolutely. Now, what do you see in the field of CTO complex PCI? What are the big things that you see coming up in the next few years in terms of new developments in practice, education, equipment, etc.?
Definitely, always the wire are changing, helping you more. So there is a lot of wires technology, how to the definite the how to move from outside, and the torque and is transmitted to the tip of the wire. And I think this always will changing and occur to have the good design. But what I want is, if I don't know if it is a dream or not, that to have a camera on the tip of the wire, so to know where I'm going. I think it will come. Not using an IVAS and not using OCT. No, I mean during the wire, the tip of the wire is a camera on the tip of the wire, so you can know where I are going inside the true human or the false human. And I think they will definitely changing connecting these imaging tools to the wire, and this is I think this will be the very high technology. I don't know if it will happen or not.
Perfect. Well, I hope it happens quickly because, as you said, the cases are getting harder and harder, and
Yeah.
we can use everything that can be developed. But how about next steps for you? What is the next thing that is in your list to do in the upcoming years?
The most important point that we are pressing on the Egyptian CTO club and all the intervention cardiologists can collect the cases and show the success rate, as we did, and sharing a lot of trials all over the world with all colleagues that help the intervention cardiologists to improve and raise the success of their procedure. I think this is the most important one, is to connect all the intervention all over the world, and it will help definitely in the improvement of the success rate in every procedure.
Perfect. And as you mentioned, there are a lot of patients in Egypt. It's a big country, a lot of patients with coronary artery disease, and there's definitely room for improvement and look for access because, as you said, it may not be available to everyone who needs it at any given time.
Okay.
Now, what do you do outside medicine? Are there some things outside medicine that you enjoy?
The playing basketball, and this is and also definitely the traveling. I like travel to go, but not conferences. I would like to relax, swimming, playing basketball, playing sometimes tennis, which is very good also for your sport. I think this is will help you a lot. And I like to have the family together, and the social activity definitely it's important to in your life, to be honest.
Wonderful. And then the one thing actually about basketball, I know, are you worried about getting injured? Because sometimes it can get a little intense, right? Do you want it like breaking a finger or causing any injury when you're playing basketball?
Yes, this is very important. Don't play like in the past, and it's very aggressive. No, you're just playing with friends, with the older friends, so they are also relaxing. We are playing, not with a small young player. If you if he's a young player, he was try to go push hard, but that's why we are love to play, not in a hard situation. But the point is, you need to have a good physical fitness before you go to any basketball play.
Perfect. And again, physical fitness, as you say, critical for the
Yeah.
success. Now, are you worried about radiation? I know you are busy, interventionalists do many cases. Are you worried about the radiation and the effects of the lead or the radiation on you?
Yes, definitely the radiation is there is a fear from radiations. We try to connect to have use the shield, the to reduce the frequency rate, the radiation rate, because when you are using the pictures, you need to reduce. This was learned from the CTO that you always need to reduce the rate, frequency rate of the your image, X-rays, and then the most important point is to use the goggles and on the eyes and the this definitely also there is protection on the head, but not all the intervention cardiologists love it, but it's very important also because especially the left side of your is very important exposed to radiation than the whole body. This is very important, and also to learn the your team because sometimes the nurses technician wants to be light, you don't want to reduce the weight of lead, so they wanted to no, you must insist to help them to be very careful about radiation, and you need to have some talks or lectures for about the problems of radiation. And I think this is very important. I think in all the CTO lectures in over the world, you need to have a session on radiation and protection, and this is always to insist. This is very important, and definitely the newer devices with without wearing anything, and but just put. But the problem is it's very expensive, so we try to have it in Egypt.
Perfect. So again, Amr, it's been done a phenomenal work on so many fronts, and you've taught so many people through your cases, through your courses. If you had to summarize and give maybe some of the key advice to new career people or new interventionalists who are starting to learn or they're thinking of starting to learn, what would be the top things you would advise them to do to become good CTO and the complex operators?
The most important to look for the pyramids, and the pyramid that the base is to learn your complex cases first. You need to learn complex cases, the normal, not CTO. You need to learn a bifurcation, good bifurcation, complex left main bifurcation before going to CTO. The CTO is the top of the pyramid, so you need to have these some cases and then to learn how to, and then to see integrate. Just try to use the simplest, the shortest with a score, very low score, so you can try to have the best result, least complications. And when you have a good success rate, and then you can go for the difficult or maybe ambiguous caps for antigrade also, and then you can do some cases antigrade. But be careful that you need to have beside you a retrograde operator, because a retrograde operator will help you. Where at any time when you fail antigrade, you can go retrograde. And when you learn some of these antigrade cases, and then you can go for retrogrades, try to use the septal only, such just a very simple crossing. Try to don't use very don't be panic, don't use cause perforations. And then if you have more epicardia, if you are more complex epicardia, and then you are reaching the top of the pyramid. But don't forget to be ready with complication kits, and this is the most important point. And it's not bad to stop your procedure. This is not to endanger the life of your patient, and this is a very important point. And you can retry at a different time. It's no problem.
Yeah, absolutely. And I think you're right that sometimes we get too focused on successfully opening the artery, and we may overdo it and do things that maybe is not in the best interest, and maybe we should just, as you say, take a deep breath, step it back. And I think many people have said the same way, that sometimes it's hard to know what is the right balance of trying harder versus just stopping and giving it some time to rest.
Yeah.
How about when you've worked very hard, do you do some of those cases? Let's say you had a lot of hard day, now it's 6, 7 p.m., and you still have a very complex case coming up. Would you do it? Would you try to postpone it for the next day? How do you deal when you have the fatigue and other issues when you do this?
The enemy of your success is fatigue. So if you have a time to reschedule, this is the best things is to reschedule your procedure in the morning. Everyone is ready to do cases, and don't do a lot of cases in the same day, complex cases in the same day, because if you have a complex case in the same day, it will be you need to hurry to finish, and then your mind is already busy, and that you have a lot of meetings, you have a lot of cases, so you need to finish the day. And the point is, you need to start with the most complex cases in the morning, and then you downgrade the cases after that, and you can use the simple cases at the end. But the point is, don't start late in the evening cases like this, which is very important to have the success.
Wonderful. Well, once again, Amra, it's been wonderful talking to you today. Thank you for all the tips and tricks. Congratulations for doing such a wonderful job creating the programs in Egypt and helping teach people. And looking forward again to work with you and see you in the upcoming meetings.
Thank you for this great opportunity to have you online. Definitely, it's very great to have these questions. Definitely, we want to repeat it again, but I want to ask you, what is next? I don't think one who do this with you. And just in a one moment, I want to ask you, do you arrange your time? Because I know that you're working, you're doing books, and you're doing a lot of things, meetings, live cases. So just give me some of the tips and tricks of you for how to arrange your time.
There's no magic trick. Like as you said, there's 24 hours in a day. They're the same for everyone. I guess for me, the key part is to write down what you want to do. I think sometimes if you don't write it down, it gets too much. It's hard to remember, okay, I have to do this. So writing it down, it's a huge step. It helps kind of decompress. And then select what's the top thing to do. And then start slowly going one by one. And then trying to prevent distractions. As you know, the problem with our profession is you're trying to do something and then someone wants you or another patient needs you. So the problem is you're being distracted and starting all over again. So for me, the best productive hours to do things that are not clinical based are early in the morning, 5 to 7 or so, when there is no other people interrupting. So once you are focused and can do something single-mindedly, that goes a long way for being more productive.
Yeah, thank you for this great tips and tricks. We have a lot of things that hear from you. Thank you for this great opportunity.
Well, it's a pleasure. Thanks again, Aaron.
Thank you for listening to the Sensei podcast.